Hello, and welcome to the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board-certified dermatologist, and I'm here to discuss with you all issues relating to the skin that you're in. In this podcast, we will tackle the topic of the day quickly to get you the take-home points that you need. After listening to an episode, you should be educated about the topic and able to fix the issue yourself or well prepared to ask the right questions at your next dermatology appointment. Let's get started. Today, I'd like to talk about PDT, otherwise known as Photodynamic Therapy. PDT is used in many areas of medicine. In dermatology, it's FDA approved to treat precancers and early skin cancers, such as early basal cell carcinoma and squamous cell carcinoma, and we also use it off-label to treat acne. The basic premise of all PDT is that a light sensitizing chemical is applied to the affected area. For us, it's the skin, and that is otherwise known as a photosensitizer. It's a chemical that makes the area more sensitive to light. We let it incubate, which is just to say that we have it on the skin for a certain amount of time. The chemical gets absorbed by the target tissue of abnormal cells, whether it's precancer or early skin cancer. And typically, this takes about an hour to incubate, and then we shine either a blue or a red, or sometimes both, types of light onto the affected area. The light plus the chemical creates a reaction in the skin, and that reaction causes a reactive oxygen molecule to form, and that kills the target tissue, or the abnormal cells, and it also induces an immune response. Interestingly, the reaction only damages the affected areas and the normal skin is left alone. So in our case in dermatology, PDT is FDA approved and used all the time to treat precancerous skin growths called actinic keratoses. That is what we use it for most commonly. The PDT treats and removes many of the precancerous cells, and therefore it reduces the number of skin cancers that the patient develops over time. We have a whole episode on actinic keratosis and the treatment options that are available. We'll link to it in the show notes in case you want more information on that. But as I mentioned, PDT is also FDA approved to treat early basal cell carcinoma, which is the most common skin cancer, and also early squamous cell carcinoma, which is the second most common type of skin cancer. And we use it off-label for acne for certain patients who cannot or will not tolerate other therapies. So the PDT seems complicated, but it's really not in real life. There are two forms of light sensitizing chemicals that are FDA approved for use on the skin at this time in the U.S. First, we got Levulan many years ago, and then Ameluz got approved more recently. They've both been around for many years. They are both forms of aminolevulinic acid. Levulan is a liquid and Ameluz is a gel. Levulan is FDA approved to be used with a blue light, and Ameluz is FDA approved to be used with a red light. But both products work with both blue and red light, and we know this from clinical practice and also the science of the chemical reactions that are occurring. So if you have an appointment for PDT, I want to describe the sequence of events so you understand what goes on. First of all, it is important to know that this treatment does not hurt. There is no pain. We ask patients to come with a clean face, but if the patient has sunblock or cream or makeup on, we will first wipe it off or the patient can wash it off. Sometimes I will then apply acetone to the face for extra cleaning to remove any oils from the surface so that the Levulan or the Ameluz can penetrate better. Acetone is basically like nail polish remover, and so it's not fun to have that applied to your face. It stings, and we ask patients to hold their breath briefly. I do not always do this. It's a clinical decision, but we often do it, especially if the skin is not clean upon arrival. Then I apply either the Levulan or the Ameluz. The Levulan is a little disposable stick that we rub all over the face or another area. Second most common area to treat would be the top of the scalp. If we are using Ameluz, it's a little bit easier to apply because it's just a gel that we rub on. Then the patient goes back into the reception area and we ask them to not sit near the window, and we time them for usually an hour. The first time, sometimes we do 40 to 45 minutes, depends on the patient's skin, but we typically get up to an hour or so over time. When their time is up, we bring them back into the treatment room, which is all set up with a light, and we have them sit on a chair. We have them goggled, and the light is shined to the skin for anywhere from a few minutes up to 16 minutes. I'd say on average, it's around 10 minutes or so. So first treatment, 10 minutes, second treatment, we could do 11 minutes, etc. Since the patient is goggled and cannot see, I always have a staff member with them at all times for safety, and the staff member wears special goggles. If the patient is experiencing burning from the light and that sensation that hurts a bit, then we turn the light off sooner if we need to. Then the assistant removes the patient's goggles and the solution from their face, applies sunblock, and they can go. We tell patients to allow 2 hours from beginning to end for this treatment. This treatment has two main downsides. The first is that it can make you very red afterwards, and that can last for a number of days, but I'd say this is uncommon. But it does make everybody sensitive to light for 48 hours, and that includes light coming through windows, indoor light, computer screens, sunlight coming through the car windshield, and obviously the sun itself. So for 48 hours, both inside and outside, the patient has to wear sunblock every 1 to 2 hours and a hat while they are awake, and they need to avoid excessive bright light. That means not taking a long drive on a sunny day, not sitting near a sunny window, not taking walks outside, not sitting too close to a bright computer screen, etc., etc. And I find that these restrictions can be difficult for some people. If the patient ends up getting really red from the treatment, which is rare, but it can happen to anyone, the redness does go away. It can last for a number of days or even a week or two. We would normally treat that with topical steroids. The patient would be calling me and either coming in to be seen or sending me photos so we could make a plan for that particular patient. I've not seen this reaction in many years, but I have seen it a few times, and it can be bright red like a cherry tomato red. More typically, there's just a bit of irritation and a little bit of redness, but nothing major, and it goes away easily with basic moisturizer and a few days of time. So on the upside, PDT works great to reduce the precancerous changes from old sun damage on the skin. For those patients, their skin is often rejuvenated and looks much better and feels much better. It's smoother and more even, and so it does have cosmetic benefits in addition to the medical benefits of reducing the risk of skin cancer. These types of patients will often do PDT in my office once or twice a year for maintenance when they have significant history of skin cancers and precancers, and this is typically done on the face and sometimes the scalp. I don't typically use PDT for skin cancer itself, as it's really for early skin cancers, and most patients can tolerate other easier procedures than PDT to treat their early skin cancers, such as desiccation and curettage, otherwise known as scraping it off. But for patients who have multiple skin cancers in a common area, or for people who cannot or will not want a surgical procedure, PDT is a great option for early basal cell and squamous cell carcinoma. I'd like to make mention that PDT also works great for acne. I will typically use PDT on someone with acne if their acne is moderate to severe and they cannot or will not tolerate more traditional therapies such as Accutane, birth control pills, spironolactone, or oral antibiotics. And this can be due to side effects or preferences or allergies, etc. The PDT is not FDA approved for acne, but it has been well documented in the literature that it works well, and I've done it many times over the years. The PDT acne protocol is a little different than the precancer protocol, and the acne protocol is once a month for 5 months and then every 6 months ongoing. It does not cure the acne, but it's a great non-invasive way to get bad acne under great control. I've seen PDT change a lot of lives and shut acne down, and there are a lot of success stories. So in summary, PDT, otherwise known as Photodynamic Therapy, is FDA approved to treat precancers and early skin cancer. We use it off-label for acne treatment. It works great. It does not hurt. It has minimal side effects, which are mainly rare redness, but the after-treatment restrictions on exposure to light can be difficult for some patients. So if you are thinking about PDT for yourself or someone you know, hopefully this was helpful to understand what PDT is, how it works, what it treats, and what to expect both during and after the treatment. Thank you so much for joining me today on the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board-certified dermatologist. I hope this episode was informative and that you enjoyed listening. If you found this podcast useful, please give us a 5-star rating wherever you get your podcasts. It helps others find us so we can help them too. Just a caveat to remember, this is not medical advice, and please see your dermatologist or doctor for questions pertaining to your specific situation. I look forward to talking with you again in the next episode.